As the days grow shorter and the nights longer, as the grip of autumn and winter bites, many individuals find their moods shifting. This lack of daylight and reduced daylight hours can bring on a type of depression known as seasonal affective disorder. Seasonal affective disorder, SAD, is a type of depression that occurs at a specific time of year, usually in the autumn or winter, when daylight hours are shorter and when the clocks go back. The reduced sunlight at this time of year can disrupt the body's internal clock, known as our circadian rhythms, and lead to decreased serotonin levels. This in turn can contribute towards depression. SAD affects approximately 5% of adults in the U.S., and is estimated to affect between 0.5% and 3% of the general global population, with symptoms lasting about 40% of the year. If you are suffering with SAD, you may be at risk of other mental health disorders, such as anxiety or eating problems. This can lead to significant impairments in daily functioning, which can affect work, your relationships, and your overall quality of life. Other common symptoms you may experience are a persistent low mood, a loss of interest in activities once enjoyed, a low energy and fatigue. Your sleep patterns are disturbed, usually combined with oversleeping. You suffer changes in appetite, often craving more carbohydrates. You have difficulty concentrating, and you may suffer feelings of hopelessness or worthlessness. If you suffer with SAD, how long can you expect it to last? Well, your symptoms typically can begin in late fall or early winter and be resolved during the spring and summer months when you are exposed to more light. So on average your conditions will last approximately 4 to 5 months. Is there anything you can do in this downtime? Well, research has been conducted into the benefits that you may achieve with the use of red light therapy. But what is red light therapy, and how does it work? Red light therapy involves exposure to low levels of red or near-infrared light, which penetrates the skin to stimulate cellular energy production. This is known as mitochondrial activity. This stimulation can enhance your cellular function and promote healing and general well-being. This improvement may mean that red light therapy could alleviate your symptoms of depression and anxiety. These benefits can also mean that red light therapy may help regulate your mood and mood swings by influencing neurotransmitter activity and circadian rhythms. By affecting melatonin production, red light therapy can also improve your sleep quality, which can be disrupted by SAD. The enhanced cellular function created by red light can lead to increased energy levels, helping to fight your fatigue associated with SAD. Red light therapy can also be used alongside other treatments, such as cognitive behavioral therapy or medication, for a more holistic medical approach. Importantly, are there differences in the causes, the effects, and daily challenges between men and women who suffer with SAD? Well, women are more likely to be diagnosed with SAD than men. If you are a woman, then you may experience more pronounced symptoms, such as hypersomnia, that is, feeling sleepy during the day, as well as suffering increased carbohydrate cravings and the challenges that brings for your overall diet and health. Men, on the other hand, don't talk. A cliché, I know, but if you are a man, then you will be less likely to acknowledge depressive symptoms and seek professional help and treatment. As a woman, you might face increased caregiving duties and responsibilities. This builds on any existing stress you may have, especially during depressive episodes brought on by SAD. Men might experience pressure to suppress their emotional feelings. This then can lead to an incorrect diagnosis. Guys, it's important to talk. But can home red light therapy masks and panels help? Home devices, such as red light therapy masks and panels, can make treatment more accessible and convenient. You simply plug in, sit back, relax, and enjoy the process in the comfort of your own home. When used consistently and correctly, these devices can be effective in treating SAD. Light masks and panels can provide benefits similar to clinical treatments. However, before you rush out and buy a device, take into account some of the following considerations. Ensure your choice of device emits light at therapeutic wavelengths. Typically, this is between 600 and 1000 nanometers. Always follow manufacturer guidelines for duration under them and frequency of use. And it goes without saying, consult with a healthcare provider or your practitioner before starting any home therapy treatment, especially if you have underlying or ongoing health conditions. If you found this video helpful, please like and subscribe to the channel as it helps us grow and bring you more useful content and health tips. Also, for references, see below, and for details on light therapy products you can use at home, click on the links below. Thanks for watching.